at the University of Essex in the UK, and so I relocated from California to rainy England recently. And so I will be moderating the rapid fire presentations, and the last year I participated. It was a great fun, and I hope this year will be the same. So in terms of logistic, I think we have 5 talks, each of them 7 minutes, and then 4 minutes for questions and answers and discussion. And with that, probably we could a session's objective. Okay, that's important. And yeah, I probably change the order a bit, but yes, again, 7 minutes presentation, 4 minutes Q&A, and then you can submit your questions for the panelists using the Q&A button, and then we'll reply, and there will be a discussion. You can also use the chat feature to talk to attendees, panelists, and the tech support. Okay. With this, I think we could start with the first talk by Raphael Cuomo about spatial temporal analysis of COVID-19 tweet trends in subnational areas of the United States. Raphael?
He should be.
No, we cannot hear you. Yep. Please unmute yourself, and probably that will be good enough.
He was put as a attendee. Let me move him over here.
All right.
Hello.
There you go.
Hello, Raphael. We can hear you now.
Excellent. Okay, so I'll go ahead and get started. So today I'm going to be talking about a spatiotemporal analysis of COVID-19 tweet trends in subnational areas of the United States. We can go to the next slide. So I don't have control over the slides.
Oh, Kristan, there you go.
All right. So as background, what we know is that infection of COVID-19 with the coronavirus itself is not evenly distributed across either space or time. And for example, you see at the bottom left there a map at the county level of the contiguous United States with coronavirus infections as of 1 week ago on November 25th. And you see that rates are much higher in the rural West and Midwest compared to, for example, the coasts of the United States. So you see that it's not spatially evenly distributed. You also see at the bottom right there that looking at the temporal distribution, that there is not an even temporal distribution. There are peaks and troughs, right? And we're currently experiencing quite a peak. And so the premise behind this study was that we care about tweets because it is a proxy measure for how concerned people are with coronavirus itself, right? And that fluctuates. And that concern allows us to measure fluctuations in preventive behaviors, which in turn has an impact on rates of infection and mortality as well downstream. So the objective of this study, therefore, was to describe the spatiotemporal distribution of COVID-19 tweets in the United States as a proxy for COVID-19 concern, right? So, and I'll describe in the next slide that I'll be analyzing the distribution of space and time for these tweets in the early outbreak period concurrently, specifically between March 3rd and April 13th for that 32-day period. And so what we did was to access the tweets, to obtain tweets using the Twitter API with the keywords corona outbreak, corona, anti-corona, coronavirus, Wuhan virus, COVID, pneumonia and pneumonia of unknown cause, which at the time was the set of keywords that was thought to, that was agreed upon by many to be consistent with coronavirus, with tweets about coronavirus 19. And so we weren't satisfied with just looking at tweets about coronavirus 19 at all, including news sources, for example. We wanted to be a little bit more specific than that. So what we did in a separate study was we took a subset of these tweets and we manually annotated them for whether or not there was evidence of firsthand exposure to the coronavirus 19 disease, including symptoms like coughing, pneumonia, chest pains, and so forth. And I used this to train a machine learning classifier using support vector machines. And then I applied that classifier to the entire corpus of tweets collected during the 32-day period for this study. To analyze these tweets temporally, we use the C3 algorithm of the Early Aberration Reporting System, which is the same algorithm used by the CDC for detecting outbreaks of rare infectious diseases. And we did this at the state level. So there is a spatial component to this analysis. To look at it spatially without the influence of time, we constructed choropleth maps of COVID-19 tweets, both in totality and normalized. And then to do what I described earlier, to look at this in a spatiotemporal manner, both space and time at the same time, we constructed what's called a space-time cube, which you see at the bottom right here, and then did emerging hotspot analysis. And what you can see is that these blue dots here toward the very bottom right would be examples of tweet instances, and the vertical component there can be bins of days. In this study, we binned our time component into days, and the X and Y are space on a 2D plane, right? And so you'll see fluctuations of tweets over time, you'll see fluctuations over space, but the objective of this was to look at both space and time at once. So if we go to the results now, next slide. So these are the results of the Early Aberration Reporting System analysis. And what we can see is that there are aberrantly high numbers of tweets around the March 29th weekend, and they tend to occur in states that are somewhat more rural. So examples would be Arkansas, Missouri, Montana. Go to the next slide. So here we see the distribution of total tweets in a choropleth map. At the top, map A, and we see that they are from where you would expect, where there are a high number of people. And at the bottom right, you will see the normalized, adjusted to county level population, and we see a much more even distribution. So looking at this, looking at the distribution over space alone doesn't tell us too much. We go to the next slide. So this is looking at them both together, and these are in 2,500 square kilometer intervals. And what's done here is, the technical details is that a G-score, get a score G-score was calculated, Z-scores of that were calculated, the Mann-Kendall test was performed, and a Z-score of that test was mapped here for each 2,500 square kilometer interval. The top map shows the increasing and decreasing trends overall for the tweets, and the bottom shows these normalized. And what you can see is that there is an increasing trend in the Deep South, and states that are a bit more rural, like Wisconsin and Minnesota. Next slide. So this is my final slide. So we uncovered about 175 million tweets, but less than 1% of them had geospatial information. Only about half of them were from the United States, and a low proportion of those were chosen by the machine learning SVM classifier. So an analysis like this can really only be done in a circumstance where you have a massive number of tweets, such as the early outbreak period in the United States for the coronavirus pandemic. A longitudinal analysis uncovered a relative spike about 3 weeks into that early outbreak period on March 29th, and normalized space-time cubes suggested that we had an increasing engagement with this topic in Deep South and rural areas of the United States. And this is important and has public health significance because it allows us to detect responsiveness to emerging public health threats. And that will in turn allow interventions to be targeted toward those communities. And that's all I've got. I'd like to thank my collaborators and funder.
Thank you, Raphael. Let's see, in terms of questions. Okay, I can't see many, but I will probably start and then we'll probably have a few more questions. First, I was thinking, is it possible to integrate state-specific policies and with messaging, Twitter messaging, and did you attempt that in other research?
Sure. Yeah. Certainly. It's possible. So states do have their own policies regarding the quarantines, and state-specific resources. I think that social media campaigns can be integrated into this. But regardless of whether or not you use social media for an intervention component, I think that surveillance with social media should be an integral part of understanding community-level variations in responsiveness to infectious disease pandemics.
Absolutely. My question was, could you expect to observe some variation in Twitter behavior, given what was the policy in the particular states?
Yes. So I think that if you were to categorize states, for example, by their policies and then determine and to assess whether or not there are differences according to states depending upon their policy, I think that's something that could and should be done. I think that's been done in the past for other topics. I don't know if that's been done for COVID in particular, but I think that that's a reasonable study to pursue.
Right, and just a final question. Have you tried to assess all concern now and develop hypotheses on where spikes might happen in the future?
Yes. Yes. So. Yeah. Right. So there is a separate study that we have pursued that has tried to model infectious disease rates of COVID using different time lags of Twitter mentions. And so we're seeing, interestingly, that in the early outbreak period that there is some prediction on a 2-week lag of areas where there are high numbers of tweets and then subsequent high rates of infection. So it's hard to say right now whether or not that's specific to an early outbreak period, or whether or not that would be, something that would allow us to predict in later outbreak periods as well. Although I should note, this is likely not the last pandemic we'll see. So in future, understanding the early outbreak period of pandemics is critically important and not irrelevant to future challenges that we're going to need to address.
Right. And there is another very interesting question, whether you correlated those rural spikes with the clinical cases or hospitalizations.
Yeah, so yes, in a separate study, we did try to do that with a time lag. So what we saw was that if we looked at the number of Twitter mentions at the same day, it wasn't quite as predictive unless you had a time lag. If you had, say, a 2-week lag, and you were to test different time lags, you're better able to find the relationship between cases and tweets.
And a final question, which is extremely interesting. Why was there a spike, and what might that mean for the states and their response? So in terms of policies based on your research, how do you see it, and how do you think that could feed into the response to the pandemic?
Right. So that's a great question. There are two separate questions though. So the first one, the reason for the spikes, I don't think that's necessarily state-specific responses. Unless you're considering the quarantine, it's possible that later stages of the quarantine in rural areas catalyzed a lot of discussion during that weekend and the last weekend of March. I think that one reason we're seeing this spike is because in areas like California, New York, we had a very high level of engagement at the very start of this study time frame, and that remained pretty high or even decreased a little bit throughout this 32-day period. Whereas there are other parts of the United States that weren't quite so interested in this topic on Twitter early on, and then suddenly you see this rise maybe as things start to get more serious. And the other question, how this might impact state policies, is that ability to target populations, knowing ahead of time how responsive your populations are going to be to these public health threats.
Thank you. Wonderful research. Yeah. Thanks.
Thank you.
Thank you. And now we move to a second rapid fire. Okay. which is mining social media for COVID-19 information by Ashlyn Doughton and collaborators.
Moving them over.
Thank you.
Ashlyn, you'll need
Okay.
to.
Yep. Can you guys hear me now?
Wait, we can, yeah.
Perfect, great. So my name is Ashlyn Doughton. I'm a staff scientist at Los Alamos National Laboratory. This that I'm going to present today is from a project over the summer. I can't start my video, sorry.
Okay.
The computers that were on at the lab don't have video enabled,
You got
unfortunately. Yeah. So this is a project that was kind of internally funded, a smaller kind of pot of money to try to do some exploratory analysis from over the summer. We had a really great interdisciplinary team. Cortni Shelley, who's listed, is also attending PRISM. So if you have any questions, I'd encourage you to also reach out to her. And I think we can go to the next slide. So this project was extremely broad, like I said, and we took it a whole bunch of different directions, which means I'm only going to talk about a tiny fraction of it. But in general, there were kind of two themes that we were interested in. One was we wanted to be able to look at social media to understand types of misinformation. And we wanted to look at how they were spreading, how they were changing over time, where they were more common. And then we also wanted to look at behaviors that people were talking about on social media, like their social distancing practices, their mask wearing practices, things like that. Because of time, I'm only going to talk about the misinformation piece. So we can go to the next slide. So the motivation for this is probably pretty clear. We're in a situation where the science is unfolding in real time. Public health guidance has been politicized in a way that's not new, but maybe more severe than kind of in previous public health instances. And we're already in an environment where misinformation is really prevalent. And so this has created a situation where I think misinformation is becoming increasingly a much larger problem. If you go to the next slide, what we know about kind of the psychological profile of people who are likely to kind of buy into misinformation is also really consistent with what we are seeing in terms of COVID-19. So for example, we know that folks who believe in conspiracy theories often feel lonely and isolated, they feel powerless, and they feel they need to have a quick resolution to the unknown. And I think a lot of people, even those of us who maybe don't buy into conspiracy theories, might feel some of these things in the past year. And so I think it's created this environment where we have even a stronger pull towards things that are not true. You can go to the next slide. So the data that we used for this project, we used a lot more than this, but I wanted to specifically call out Twitter and Reddit. We used a repository from Chen et al., which now has over 500 million tweets. At the time that we did the bulk of this analysis, we were using about 150 million tweets. We've also pulled a huge amount of data from Reddit, which I'm not going to talk about at all, but if anybody is interested in Reddit, we've done some super cool things with them and I'd love to connect. The last thing that we used is this website called NewsGuard, which is a website that tracks about 6,000 different websites and scores them according to journalistic standards of credibility and trustworthiness. And early on in the outbreak, they had started to identify specific COVID-19 myths. And they went so far as to identify tweets that were important to those myths and instances where the myth kind of hopped onto social media and became more prevalent as the result of somebody tweeting about it. Next slide. So the methods that we typically use for a lot of this work is we generally start with a lot of exploratory analysis, and this involves identifying a bunch of keywords. For this work, we identified keywords related to the top myths that were identified by NewsGuard, and we did a lot of exploratory stuff. We looked at temporal analysis, we did some network analysis, and found that there were a lot of folks who were tweeting about multiple different myths, which kind of implied that there was a lot of overlap, which was interesting. And then we decided to zero in on 4 specific conspiracy theories. And to do that, we labeled several thousand tweets with if they were instances of misinformation related to those specific conspiracy theories. And we built supervised machine learning algorithms to automatically identify them. Then we used our classified data to do a bunch of downstream analysis, geospatial, temporal analysis. We did some sentiment analysis. And the most, in my opinion, interesting stuff that we did was some unsupervised learning. In particular, we did some dynamic topic modeling, which lets us see how word importance within a specific conspiracy theory changes over time and allows you to see kind of how conspiracy theories are shifting. Next slide, please. So these are the 4 conspiracy theories that we focused on. I'm not going to go into details about them because it takes a long time to explain them, but the 2 that I actually show some information on, some results on, are the origin story, which is the idea that COVID is a bioweapon, and then the misinformation around anti-vaccination rhetoric and vaccine hesitancy. Next slide. So we found a couple of things repeatedly. And the first one is that we found that history repeats itself. And by this, what I mean is that we found that conspiracy theories are recycled, which is something that was clear already in literature, but we found it again here. So this word cloud is from tweets that were classified as being misinformation related to COVID being some sort of bioweapon. And so words that are bigger are words that were more common in these tweets. And you see a lot of things that you would expect. There's stuff about laboratories in China and Wuhan and the coronavirus. But we also see some things that are kind of interesting. So if you go to the next slide, we see first that there's overlap with other kinds of conspiracy theories. You see references to Jeffrey Epstein's death. We see overlap with the Bill and Melinda Gates Foundation conspiracy theories. And then we also see references to previous conspiracy theories that are almost identical. For example, there was a conspiracy theory about Ebola, that it was manufactured in the United States somehow. And so we see references to that, which is pretty interesting. And then if you go to the next slide, the other kind of big thing that we found is that conspiracy theories evolve, and we can use these unsupervised learning methods to look at that evolution over time. So these are heat maps that show word importance. The words are along the y-axis, time is along the x-axis, and they are colored in. So darker blue are words that are more important in that time slice. And so these are from tweets that are misinformation about vaccine things that are, they're typically anti-vaccination or misinformation about vaccine hesitancy. And they're super detailed, so it would take me a long time to go through why all of the pieces are interesting, but I want to point out just 2 quick things. One is that in topic 2, you can see kind of linguistic shifts in the way that we talked about COVID. So early, for example, in January up through March, nobody is using the word COVID because it hadn't been coined yet. And then, middle of March, COVID becomes a word that starts being used, and you can see it kind of increase rapidly in popularity. We also see other things that are interesting. For example, there's the word microchip that kind of briefly in April pops up as being more important. And that's because there was this kind of conspiracy theory about the Bill and Melinda Gates Foundation building a vaccine and then using the vaccine to microchip people. And so you can kind of see specific instances of where a specific niche of the conspiracy theory pops up. And I think you can go to the next slide. So we have a paper that we're working on. It's very close to submission that kind of goes into all of this in a lot more depth, but I'm happy to use whatever time is left for questions. And like I said, please feel free to reach out if any of this is interesting.
Great. Thank you, Ashlyn. We have a few minutes about questions, and I will start with a question from one of our panelists about statistical approaches and the possibility to identify early on emerging myths, and so that it's early enough to have potential, to prepare potential interventions and before they go viral.
Yeah, so all of these data that we collected, you can collect in real time. Obviously, we did all of this retrospectively. The big problem is that you need some sort of training data set to identify the conspiracy theories. And so that's something that we've been really focusing on for the next kind of phase of research, is how to take what we've learned and figure out how to make it operational. Because we know from research that as a public health community, we need to be much faster in addressing misinformation than we are right now. And so I think it's possible to use kind of these methods in a way that would be more useful from a communication standpoint, but I think we're kind of far away from that right now.
Right. A few quick questions. One of them, at this stage of the pandemic, do you think that conspiracy theories and their endorsement will increase or decrease?
At this stage of the pandemic, do I think misinformation is going to increase or decrease?
Yes, and
I don't think it has decreased at all, but it has changed a lot. One thing that we've noted is that everything that we looked at it becomes important and it's kind of bursty. It's important and then it fades away. And so it's kind of staying on top of what the new conspiracy theory or misinformation piece is, I think is going to be tricky. And as we move into actually having a vaccine available, that's something I'm very both concerned about and interested in.
Okay, thank you. Wonderful talk. Thanks a lot. And
hi again, everyone. I'll be presenting next.
Yep. So, Meredith, please, you introduce your topic and.
Sure. So, hi, everyone again. I'll be presenting a work in progress titled Digital Perspectives on Cannabis Use and Online Opioid and Opioid Recovery Community Discussion Forums. And once again, I'm an epidemiologist and social scientist at UCSF. I'd like to acknowledge my collaborators, Alicia Nobles, who I reconnected with at PRISM last year, and Johannes Truhl. I'd also like to acknowledge the online community contributors and moderators, and I'm funded on a Career Development Award from the National Institute on Drug Abuse. So there's been a lot of focus, of course, on COVID-19, but just a reminder that we're in the midst of an ongoing opioid overdose epidemic, which in some ways has been made worse by the COVID pandemic. There's a growing interest in the potential of cannabis and cannabinoids to reduce opioid use and related harms, either as a tool for pain management or for addressing opioid use disorder. In 2017, the National Academies of Science, Engineering, and Medicine released a comprehensive report on the health effects of cannabis, concluding that there was substantial evidence for cannabis as an effective treatment for chronic pain, but no evidence to support or refute the use of cannabinoids as a treating addiction. They also noted several regulatory barriers impeding more conclusive research, including the inability of federally funded researchers to study the cannabis products sold and used in states where cannabis is now legal. So in the meantime, we can use social media research to learn from the lived experiences of people who use these substances and share these experiences online. In my work on substance use in social media, I focus on the Reddit platform, which is a social media and news aggregation platform that allows users to interact through thousands of topic-specific forums called subreddits. Users contribute through pseudonyms, which may lead to greater tendencies to disclose hidden or stigmatized behaviors like substance use as compared to other platforms. People also interact through upvoting or downvoting posts and responding to posts in the comments. Reddit is currently the 7th most popular website in the United States with 52 million daily users worldwide. And in 2019, the Pew Research Center added Reddit to its annual surveys of social media use and found that about 1 in 10 US adults use Reddit. So the data source for the present analysis is 45 months of posts from 2 subreddits, and these were accessed from the BigQuery data repository. This included about 16,000 posts from an opioid recovery subreddit that functions as a support community for people in recovery, and about 163,000 posts from an opioid use subreddit that is more broader discussions of active opioid use. We used a filter, a keyword approach to find posts that mention cannabis-related terms using the keywords weed, cannabis, marijuana, pot, reefer, ganja, THC, and CBD, and added some white space to remove false positive like spot and healthcare. Our first question was to determine what proportion of posts mention cannabis and how do they compare between these 2 subreddits. 5.4% of posts in the recovery subreddit mention cannabis terms compared to 2.6% of posts in the opioid subreddit. So cannabis-related posts were about twice as prevalent in the recovery subreddit than in the opioid subreddit. Next, we used automated text analysis to provide insights into large-scale patterns of cannabis mentioned in these 2 subreddits. These 2 figures represent the top 25 trigrams or 3-word phrases and posts that mention cannabis. I know it's kind of small, but I'll highlight some of the ones that stood out. This was done in the quantitative package in R and included pre-processing to remove prepositions and other stop words and used term frequency inverse document frequency weighting. So the most frequent phrases in the recovery subreddit included mentions of CBD along with kratom and benefits. People also use phrases like using marijuana to treat addiction, success stories with marijuana, and planning taper on Subutex, which is a medication for opioid use disorder. In contrast, the most frequent phrases in the opioid subreddit, while they also include CBD, mention CBD along with oxycodone. Specific anti-anxiety pill names like Xanax and Valium, and opioid pills like Oxy, Tramadol, Dilaudid, as well as different forms of heroin were also mentioned. Phrases related to cannabis noted interactions between opioids and cannabis, like weed potentiates opiates, and combining tramadol weed. To contextualize these results even more, we are currently conducting a qualitative analysis of 200 random posts, 100 from each subreddit. 50 posts have been triple coded to refine a codebook that guides labeling a post for disclosure of any personal use of cannabis or opioids, as well as the context and motivations for cannabis use in relation to opioid use. Some preliminary themes and sample anonymized quotes are presented here. A common theme in both subreddits was the use of cannabis to manage opioid withdrawal symptoms, which can include severe nausea, sweating and shaking, anxiety, and insomnia. In the recovery subreddit, this was usually during an intentional stoppage of opioid use. For example, this one person says they're 48 hours in and they've been using weed every few hours and it's been making it tolerable. In contrast, while withdrawal symptom management didn't come up as often in the opioid subreddit, when it did, it was more during an unplanned break in access to opioids. So this person's saying they made it through several days of dope sickness until they got more opioids thanks to weed and Imodium. Another theme that came up in the recovery subreddit was questioning the compatibility of substance use during long-term recovery. This person asking, what's your idea of clean? And in the opioid subreddit, polysubstance use or using cannabis and opioids at the same time also came up. So in summary, despite the lack of conclusive medical evidence about cannabis as part of opioid use disorder treatment, these findings indicate that people who use opioids are using cannabis during planned and unplanned reductions in opioid use and are seeking support from peers online. The feedback we seek for this work in progress is first a statistical question about comparing n-gram term frequencies across different data sources. If anyone's used the keyness feature in the quantitative package, I'm interested in interpreting that feature. And our second question is about publication venue and audience. I typically publish in drug policy and public health journals, but we're thinking of targeting this more for a clinical audience. So if there's any clinicians who can share how they access social media data or research, that would be really helpful. Thanks for listening, and I'm happy to take any questions.
Thank you, Meredith. Wonderful talk. For now, we have one question from Dana Late, which relates to more about the data sources and the filtering strategies you used.
Yeah, so what's the question? I can't see it.
It's more related to the types of, I think the filtering strategies that you use would be useful. It could be, if you say more about
yeah, so so for selecting the subreddits, this came from just being familiar with the Reddit platform and the different communities that they're on there, and spending time on those and understanding, reading through a lot of posts, and to get an idea, are they discussing the topic that I'm interested in? And then for the keyword filtering, I do research on cannabis and also it's good at places like Urban Dictionary to get some of the terms. And so then we just looked at, for a given post, does it include any of those string terms?
Right. And if you say more about the R package, probably that will be helpful for some people that are now starting with this.
So say more about, sorry?
The R package that you have used?
Yeah, so I used the quantata package because that's really good for getting at creating these n-grams, and you can specify whether it's like 1 gram, bigram, trigram. You can go up, you can specify that. It also has some pre-processing features. Another package I've used a lot is the TM, or text mining package, and that has a lot of again, really helpful features. And there's several online yeah, whenever I Google stuff, it's easy to find examples of people who have applied that, and on like Stack Exchange websites like that.
Wonderful. Thanks a lot.
Oh, just one more thing. For the data source, I used the BigQuery. The BigQuery, I think that's what it's called. Sorry, I'm blanking on it now, but I can share more of that offline too.
I think some of those questions, including now, Michael mentioned that you could actually post the packages that you've used in R and also the data sets, and give some more details, because those will be useful for some of the people in the audience that want to start this research and using R or Python and other computational tools. Great, thanks a lot. Now we're moving to our fourth talk, right?
Meredith, could you stop sharing your screen?
Oh, sorry.
Right, and so this is a talk by Cortni Bardier, and it's about e-cigarettes and transition of use behavior on Twitter.
Hi everyone, my name is Courtney. So today I'll be discussing characterizing e-cigarette transition of use behavior on Twitter. Okay, and then you could just go to the next slide. Okay, so the aims of the study were to identify and characterize organic user conversations of electronic cigarette users and their attitudes towards vaping attitudes and transition of use on the social media platform Twitter. And the objective was just to collect Twitter data pertaining to transition of use and what people were discussing on Twitter in regard to electronic cigarettes. And next slide. Thank you. So the methods used for this study was collection of posts from 2018 to 2019 on the social media platform Twitter, and analysis of data using keyword filtering and the by-term topic modeling, BTM, which is an unsupervised natural language processing approach. From then, the user signal posts from the data set were analyzed using BTM and then manually coded for content analysis using an inductive coding scheme on Atlas TI. And the keywords that were used, some examples are e-cig, e-cigarette, vaping or vape, but then wanted to exclude anything such as like tobacco or cigarette because that would include a lot of noise within the data set. And then transition of use was classified of transitioning from one tobacco product to the next. And then you can go to the next slide. So 5,728 tweets were collected, with 657 being related to transition of use. Of those 657 signal posts, those were categorized into 9 parent codes, which included inquiry, interaction, observation, opinion, promote, reply, share knowledge, transition, and use. Next slide. So from there, the parent code categorized tweets. So there were 9 tweets that were related to an inquiry, 6 for interaction, 7 for an observation, 46 for an opinion, 37 for promote, 2 for a reply, 1 for share knowledge, 285 for transition, and 258 for use. So now I'm just going to go over some examples from what was found within the data set. So something such as like an inquiry. Is anyone a former e-cigarette, vape, or Juul user? If so, how did you quit? What healthy habit, if any, did you replace with? And then feel free to private message me. So anything related to that was classified as an inquiry for observation, but on a more positive note, I went to the smoking section so I could hit my vape, and there are more people smoking Juuls than cigarettes, so that's lit. And then for use, slowly but surely weaning off of my nicotine addiction, I switched from 6 milligrams to 3 milligrams last week, and I don't feel like I need to hit my vape as much. So then that was classified as use, so people actively using electronic cigarettes and vaping. And then for share knowledge, the Juul e-cigarette contains 59 milligrams of nicotine, about 3 times the amount of a typical e-cigarette or vape device, and they're not sold in the EU as a result of that substantial nicotine content. Wow. And then for reply, this is just like someone replying to somebody else's tweet. So Sirens give a bigger head rush, and also they're cheaper to refill. 4 Juul pods that are like 0.7 milliliters each is the same price as 30 milliliters bottle of vape juice. Sirens are a better overall investment. And then for transition, side note, haven't had a cigarette in over 3 weeks, so glad I kicked that habit, all about that vape life now. So that's more so of them just transitioning from a cigarette like tobacco product to vaping and e-cigarettes. And then for promote, this is someone, if they're like promoting a specific type of brand or a specific e-cigarette. So this one here is the Breeze. Haven't had an actual cigarette in about 24 hours. This is called a Breeze 2. It's changed my mind about vaping. This isn't a hobby vape, and it'll never be filled with banana cream pie or any other ridiculous flavor. It's to get me off nicotine, and so far it's worked. And then for interaction, this is like an interaction if someone, not between 2 users, but more so just what someone like interacted with in real life. So this person, they worked at a vape shop, and I want something, the customer asks, I want something that feels like a cigarette, tastes like a cigarette, has as much nicotine as a cigarette, but it's not a cigarette. And what do you have for me? And then he says, well, directions to a gas station so you can just go buy cigarettes. And then for opinion, this is just someone's opinion on e-cigarettes in general, on the FDA's possibility of banning flavor vape. I think this isn't that good of a call when people get addicted to smoking. It's not just the nicotine they crave, they'll eventually even crave the throat hit, flavor, smell, and even filling a cigarette in between their lips. Okay, so in summary, the results provide insights into organic conversations surrounding electronic cigarettes and transition of use that may not be available in other instruments such as surveys. The conversations that were happening were diverse, ranging from transition, use, product promotion, and general sharing of knowledge. However, future studies should focus on validation of themes associated with e-cigarettes on social platforms to inform and influence public health efforts towards addressing tobacco and nicotine addiction prevention. And we should just find other ways to find organic conversations, because we know people are discussing these topics, and the people who use Twitter often tweet about their experiences, but it's just more so what other ways can we use to like surveil what people are talking about on different social media platforms. And that's what I have for y'all today.
Wonderful, thank you. Let me see if there are any questions. Not yet. I would like to ask a question related to the public health policies that you see emerging from this kind of research. I think it's very interesting how you create those different themes and topologies. And this rich information, what is your opinion, in what way it can be feed into public health policies?
I think how this can inform policies is basically just trying to figure out what people are talking about and getting at. So in the interaction slide where the guy that worked in like the vape shop, like people are coming in, like they don't want to necessarily smoke cigarettes, but they still crave like the cigarette smell. So he was suggesting like they should just go buy cigarettes. So maybe find more policies that are allowing people to step away from cigarettes and go more into the e-cigarette route, but also make sure that e-cigarettes are actually helping folks kick their not nicotine addiction, but kick their cigarette habits. So yeah.
Right. Another question, a little bit more methodological. When you analyze those different themes, do you assume that they're always from different users, or do you have information longitudinal about the users and whether they can actually use different themes and topics across time?
So do you want to know if like it's like the same users from the tweeting like a lot, or if it's more like
it's rather whether you can observe over time people to change the themes that you observe across time.
Yeah, I think that's possible to figure out like if what they thought in the beginning is different once more information comes out on e-cigarettes, or if like now maybe they aren't a user anymore and they've kicked their habit now, or if just like what they thought have changed. I believe that's possible, yeah.
Wonderful. And a question from Erin Vogel. Did you identify anti-vaping content on Twitter too, or it was mostly pro-vaping?
So for this one, it was just more so just trying to figure out what people were discussing. A lot of it was more pro-vape rather than like negative. A lot of it was a little bit more positive when you do the sentiment analysis, but more so more negative was seen with just the opinion category, whereas with the other categories, they were either neutral or more so positive, specifically for the promote, transition, and use. Those typically lean towards being more pro-vape, whereas the opinion lean towards being more negative.
Okay, and a last question from Michael Dinner from the panelists. Have you been thinking about how to find specific new emerging social media platforms that are used by your cohorts in order to follow them and kind of continue your research on different social media platforms?
Yeah, I think that's good to continue using this as a first step, and then following the cohorts just to really figure out what's going on and just to get like a more robust study and a more stronger sample than what's already presented inside of this Twitter data.
Wonderful. Thank you.
Thank you.
And now we're moving to our last presentation, examining misinformation spread of scientific evidence.
Hi, I'm Michael Haupt. I'm a PhD student at UC San Diego, and I also work at Tim Mackey's lab. So what I'm presenting today is examining misinformation spread of scientific evidence, particularly on hydroxychloroquine Twitter discourse using machine learning and what we call echo scores. So yeah, next slide, please. Thanks. So yeah, as a quick background, so on July 27th, President Trump retweeted a video falsely claiming that using hydroxychloroquine was a cure for COVID-19, despite well-documented concerns about hydroxy safety. On the right, there's a screenshot of an example of the type of tweet and information that Trump has been retweeting in the past couple of months. So Trump's retweet is related to the broader COVID-19 infodemic, which involves deliberate attempts to disseminate wrong information to undermine public health response. And the reason why this study, we kind of looked at more of scientific evidence as a form of misinformation spread, is that like even for people who are scientifically trained, it can be difficult to assess whether a study or a finding or something that looks, or at least presenting like a scientific study could be trustworthy or not. So that's why we're kind of focusing on this type of misinformation to kind of see how that could play out to the larger lay public. So for methods, we collected tweets on the Twitter API using hydroxychloroquine and chloroquine as keywords from July 27th to the 31st, so the day when Trump sent his tweet and a couple of days after. Since we had over about 2 million tweets, we used an unsupervised machine learning approach. Cortni also kind of mentioned this in her presentation, called bit term topic modeling. And the reason why BTM was used over like other more traditional NLP approaches is that it's designed more specifically for short length documents such as tweets. And this helped cluster the tweets based on textual similarity. So then we took the top 10 most retweeted tweets from each topic cluster and then manually coded them to identify misinformation themes. And the 3 themes that we endorsements. So someone's, says like, as a MD, PhD, I support the use of hydroxy for COVID. Then we also looked at supportive scientific evidence. So whether the study basically supports the uses of hydroxy, and then opposing scientific evidence. So if the evidence discourages the use of hydroxychloroquine for COVID treatments. Then we also calculated what we called echo scores. So it basically takes the total number of tweets for each topic and divided by the number of unique tweets. And this is all based on text. So the higher echo scores would indicate a higher number of replicated tweets with identical text. And the reason why we kind of looked at this was just to see like how much of the same message just being replicated throughout a discourse. So to kind of some of an indirect measure to kind of look at potential echo chamber effects. So for our results, in total, we had 532,199 users associated with our data set. 88.3% of them were engaged in topics that expressed primarily positive sentiment towards hydroxy, compared to only 5.5% that expressed negative sentiment towards its usage. We also, of our over 2 million total tweets, 18.04% were within topics featuring a medical endorsement for hydroxychloroquine. 1.34% featured scientific evidence supporting hydroxy usage, while 0.51%, so less than 1%, featured opposing scientific evidence. So at least on the topic level of the discourse, it does seem like there is a predominant positive sentiment towards hydroxy usage, and medical endorsements were a pretty prevalent theme throughout. Then we also looked at some timeline and compared echo scores. So as you can see on the top right table, medical endorsement and scientific support topics, which were mostly the misinformation topics, had much higher echo scores compared to the scientific opposition topic. So this indicates, higher levels of retweets without additional commentary. So these messages were unaltered more often in these misinformation topics. And if you kind of look at the timeline analysis, so not only does this visualization kind of also show another way of reiterating the point that there's a much higher volume of the medical endorsement and scientific support on topics compared to the scientific opposed one. But it also kind of shows that there's a higher duration of these conversations going on. So if you kind of zoom into your screen a little bit at the green line for scientific opposition, there's only really about 1 or 2 peaks kind of around July 28th and gets a little into July 29th. But then the conversation kind of tapers off for the rest of the discourse, while both medical endorsement and scientific support themes have multiple peaks throughout, which indicates that these conversations are going on longer as well. So, so not only is there just a higher volume of pro-hydroxy sentiment and those top theme topics going on, but these conversations are going on for a longer period of time too. So some high-level takeaways. So the majority of the hydroxychloroquine Twitter discourse revolved around topics expressing positive sentiment towards its usage, and misinformation such as medical endorsements and supportive scientific evidence were prevalent themes throughout. Topics with high levels of hydroxy support also had higher echo scores, indicating that the information from these tweets are transmitted unaltered across the communication networks, at least on Twitter. And these results demonstrate the need for higher online engagement from public health officials in disseminating accurate and up-to-date scientific evidence that is also messaged consistently across health-related online discourse to combat, or at least to try to mitigate the spread of the misinformation. And yeah, that's it. Okay, I guess there's a question in the chat. So any explanation for what triggers the multiple peaks? Not necessarily. I think just, I mean, it could also be possible that just because someone is engaged in a topic doesn't necessarily mean that they support it too. So if you're in a predominantly positive topic, there is still a chance that you could be, refuting it. But at least from the other analyses, it did show that those misinformation topics also had high levels of sentiment, positive sentiment towards hydroxy usage too. But it could just be, that they're more motivated of bringing up their points more potentially.
Okay, great. And a question about the possibility that bots retreat scientific opposition in terms of good info, scientific evidence, and could that change the overall discourse?
So like using bots to promote like the use of positive or like accurate scientific evidence?
Absolutely, yeah. What do you think would be the role of that?
Yeah. I mean, I think totally. I think that could be a very effective way. And I mean, especially since, there is probably a good chance that at least a lot of the misinformation could be being promoted by bots. So, kind of a way to challenge, to kind of combat the bot usage could be, using bots for good.
Yeah. Yeah, there is another question that relates to that. I'm wondering about the thoughts of all of you about how we can use the research to effectively combat misinformation or encourage healthy practices. And I think in a way how we can kind of relate to the previous research. What is, in your view, how your research can be used for policies, and at what stage it can be informed, and what actions that could support in particular?
Yeah, and I mean, I think this also kind of goes to just like, when is a scientific evidence misinformation or not? Because I think there's a lot of times where, it could even just be like well-intentioned scientists who, I mean, science in general is a very iterative process. So, a lot of the time, or sometimes it could even just be the scenario where someone's just retweeting a old study that says the wrong, the wrong results, but now, newer studies now say the opposite. So it really kind of, I think, I think it shows the need of so when there is new information known, that information needs to be, transmitted and communicated kind of, as soon as possible, or at least on a more timely basis. And I think, kind of going back to the bot usage, that could be, a way to kind of promote those ideas and information, and kind of keeping people updated and trying to make it easier for, especially for people who aren't necessarily scientifically trained, or maybe not follow scientists or, the CDC on social media, making it as easy as possible to be able to at least come across this information.
Right, and a bit more methodological question. If you want to disentangle misinformation from disinformation, at some point when there is sufficient scientific evidence, how possible and how difficult is that, and what challenges there will be in terms of methodology and tools you would use?
Yeah, I mean, I guess depends on when the time frame of when the data is collected. So I guess kind of looking, all right, like at least during this year, you know, that you're looking at, like that was at least what the consensus was, so that you at least can get an idea of like what the underlying intentions are when someone was sharing, you know, a study or information. Because, you know, yeah, exactly, like using citing a study from 1950 that, you know, is outdated, like now might, you know, have like a more of a, you know, underlying intention to it versus, you know, if there's a lot more studies that kind of say the opposite, you know, more currently. So I think properly contextualizing the data would help a lot.
Absolutely. Thank you. Thanks a lot.